Hello and welcome. You're watching BT TV. I'm Tanya Neja and I'm delighted to have with me a very special guest today. We have with us Dr. Shyam Bishen, who is the head of health and healthcare and member of executive committee at the World Economic Forum. First of all, thank you so much, sir, for taking the time out and being with us here on BT TV.
Thank you so much. Thanks for having me here.
Okay. So, sir, let me first ask you about the health crisis and the climate crisis, because WHO chief said that climate crisis is a health crisis too. So, why don't you tell us more about that and talk to us about the impact of climate change on healthcare sector?
Yes, that's a very important question. In fact, we launched an initiative about a year ago to answer to just that question, how do we measure the impact of climate change on human health? We know that many of the disease areas are increasing because of the climate change. Global warming is having an impact on infectious disease, on vector-borne diseases. You see mosquitoes in areas where there were no mosquitoes before. Now with the global warming, warmer temperatures, you see mosquitoes even in New York. You've seen some cases of dengue in New York. That is directly because of the climate change, because of the global warming. So most of the vector-borne diseases, whether it's malaria, dengue, Zika, chikungunya, and others are increasing. Same way we see that because of the air pollution, because of the extreme weather events, respiratory diseases, cancer, lung cancer, cardiovascular diseases, they are all going up. So overall burden of disease at the global stage is going up because of climate change. We need to respond to that. So far we have focused on decarbonization. We have focused on how do we reduce the overall emission of green gases, which is absolutely correct, and we need to do that to make sure that climate change does not accelerate. But we also need to look at what's happening to human beings so that we can prepare for that. So we are now working with WHO, we are working with the G20, we are working with many private organizations. We are trying to bring both public and private sector together to answer to that, so that we can first of all quantify in terms of what's happening to human beings, what's happening to various disease areas, and then come up with good adaptation and preparedness. We must have good adaptation strategies. Obviously, we are working on mitigation by lowering the carbon emission. Overall, healthcare industry is responsible for about 5-6% of carbon emission, which is pretty big, and we need to lower it. We need to bring down our own, from the industry, our own carbon emission. But we also need to look at adaptation and preparedness. We want to make sure that the overall health systems around the world, especially low and middle income country health systems, are well prepared to respond to this climate change. I think we see, for example, in Africa is responsible for less than 5% of the overall carbon emission. Actually, some say it's around 3%. But more than half of the burden of the climate change impact on human beings is coming in Africa, is happening to people living in Africa. How do we make sure that the health systems are well prepared to respond to that, in particular in low and middle income countries? You may have seen our report. We issued one report during COP28 in Dubai, where we said that, overall, if we don't do anything, if we continue on this trajectory, we will have about an additional 14.5 million deaths between now and 2050. That's a lot of people dying between now and 2050, in about 25 years. The economic burden is also huge. We have about 12.5 trillion economic losses because of the climate change and its impact on human health. So we must do something, and we must respond to this now.
Absolutely, sir. But as we are talking about the challenges, so air pollution is also one of the biggest risks at this point in time. So how do you plan to tackle that, and what needs to be done to address that challenge?
Yes, for that, again, you are looking at the Clean Air Alliance that we have. We have a CEO Alliance for Clean Air, where we are, again, trying to bring down the overall green gas emission. And since I am responsible for health and healthcare center, we are focused on healthcare industry, making sure that we don't have as much wastage in our system. We don't have, we are using green energy in our production, in manufacturing of drugs and other products that are used in the healthcare system. So we are trying to reduce the overall carbon footprint from the healthcare system. So that's the first thing. And then once we understand what is the air pollution doing fully, once we quantify this, we know what's happening, obviously, as I mentioned earlier, you have asthma, you have COPD, you have lung cancer and other diseases of respiratory going up. We must come up with a way to not just quantify it, but also come up with diagnosis and treatment that can be easily available in low and middle income countries. Obviously, high income countries, developed countries have a bit of a better preparation. The quality of air is also not as bad. But when you talk about the middle income countries, low income countries, the problem is serious there.
Absolutely, you said it. And when we talk about climate funding,
yes,
you said we need $1 trillion investment.
Yes.
So I would like to know it from you that how close are we to that mark?
Oh, we are quite far away. We are quite far away. We are lucky though that this past year during COP28, first time in the history of COP, there was a health day. So finally everybody is waking up and realizing that we really need to look at the impact on health. So they declared December 3rd as Health Day. During that time there was quite a bit of pledge coming in, both public, private sector, as well as from philanthropies. So we are close to $1 billion. And so as you can imagine, that's far, far away from $1 trillion. But I think we are at a good start now. At least finally we have started on this. Development banks, World Bank and others are working with us on this. They are working with other banks and private sector, as well as now G20 is focused on this. So I think it will accelerate, but getting to $1 trillion, and the $1 trillion is needed to build the health system that I talked about. We want to make sure that we are prepared to respond to the impact on human beings. So it's needed for adaptation strategies, it's needed for mitigation as well as for preparedness.
But are you happy with the progress?
I would be happy once we get, a few more billions there, So the progress is slow, but I'm happy that we have started on this journey.
Absolutely. Yeah. And you also talked about the Digital Healthcare Transformation Initiative. So why don't you tell our viewers more about that?
Yes, so the Digital Healthcare Transformation is an initiative that we launched in our annual meeting in Davos in January.
Yes.
This is to tackle some of the challenges on the healthcare side, such as access, outcome, and inefficiency. As you know, that the cost of healthcare is out of control.
Yes.
In the US, it's close to 20% of GDP, 17-18% or so.
Yes.
That is huge. In Europe, it's still double digit. In many countries, you are looking at a real acceleration in overall cost of healthcare. We cannot continue like this. The overall cost is about $12.5 trillion now. It will get to be $25 trillion by 2040 if we continue like this. $25 trillion is a big percent of our overall GDP, the global GDP.
Yes.
How do we control that? You have other challenges such as the health inequities, where many people in low and middle income countries, many people in rural areas don't have access to health care.
Yes.
You also have challenges with outcomes in diagnosis and other treatments. You don't have good outcomes. We do see, obviously, digital health is not going to solve every problem, but we do see this as a great opportunity for us to make use of, first of all, health data, and secondly, breakthrough digital technologies such as artificial intelligence, machine learning, to tackle some of these problems. We saw during COVID, telehealth was a big help.
Yes.
Right here in India, we are working with Apollo Hospital.
Okay.
So Apollo Hospital Network Foundation, together with US Telecom, they launched a telehealth program they established 5 dispensaries in a state called Madhya Pradesh, where they are reaching out to rural areas. They have reached out to about 250,000 patients in that part of the country. It's a great example that how you can, through your telephone, through your technologies, televideo technologies, you can reach out to people in rural areas. You can prescribe them medicine, treatment, and then get this to people.
Yes.
So that's one example, in terms of creating access through digital technologies. Now we are trying to take this one step further, where we would be looking at virtual technologies. So not only it's telehealth, not only it's on your video phone, but you could also do this in metaverse, in virtual reality. So that's another area that we are exploring. We are also trying to see how we can cut down some of the administrative burden on healthcare workers. In developed countries, in the US, 35% of workers' time goes in administrative work.
Yes.
35% of a doctor's time going on filling out paperwork. That can be all channeled to digital technologies. AI can help there a lot, can do your diagnosis much faster, much easier. It can also do all the scheduling and insurance and other paperwork, so that the physicians are free to do what they were trained to do, which is in taking care of the patients. So we do believe that by cutting down the administrative work, we will not only increase the efficiency in the system, we will also cut down the cost of the overall healthcare delivery.
Absolutely. And you talked about AI.
Yes.
So every sector is now betting big on AI. It's the talk of the town. So let's understand from you the role of AI in healthcare, and what kind of an impact do you see, what opportunities do you see that AI might create for the healthcare sector and for clinical development as well?
Yes, no, AI has really big potential overall. We are looking at AI in healthcare. We are working with G20, with WHO on that. Obviously, you have to make sure that there is a responsive use of AI. There is a good governance for that, because AI can also be misused if not done properly. We want to make sure that there is a good, trustworthy health data available, because AI is based on data. If you don't have access to good data, it's basically garbage in, garbage out.
Yes,
so we want to make sure that we have access to good health data, and then based on that we can build artificial intelligence, machine learning, and through that you can again provide much better diagnosis. It's already being used for breast cancer diagnosis, as well as some other cancers, where the AI can diagnose diseases, can diagnose cancer much faster, much better, much more accurate. So that is happening. We are also trying to see how we can use AI in drug discovery and development. In drug discovery, it's been already used for some time now, for a few years, and we see some of the clinical development candidates coming from drug discovery that was done through AI. We are working with a company called In Silico, for example. They have a few candidates in clinical development. Now, the clinical development is a big part of the overall R&D process on the drug development side. We are trying to see how AI can further accelerate clinical development by recruiting patients faster, by recruiting diverse set of patients across different geographies, also by managing clinical trials, some of the administrative work that I mentioned, and then on the regulatory side. I think in the whole value chain, if you look at, the AI has the potential to cut down the overall development time of drugs, which is 10 to 12 years, to by 30-40%, depending on how you calculate it. Also cut down the cost of drug development, which is close to $2 billion now. So I think AI has a huge potential on the drug discovery and development. It has a great potential on delivery side, where AI can again help the doctors and nurses to do their job better, and can also tackle some of the healthcare worker shortage We see there is a big shortage. According to WHO, 10 million healthcare workers will be needed extra between now and 2050, and the pipeline is not there. We don't have the training program to fill that. So there will be a 10 million shortage of the workers, healthcare workers, by 2050, and we believe that AI can do a big job there.
Okay, absolutely got that. And let's talk about women's healthcare also.
Yes.
Something which is very important, but I feel it's underrated here in India. So you launched a global alliance with the Gates Foundation in Davos.
Correct.
So if you could tell us more about that, and how do you look at the progress that India has made so far when it comes to women's healthcare? What more needs to be done at this point in time?
Yes. No, you're correct. We launched this big alliance a few months ago, in January in Davos, together with Bill and Melinda Gates Foundation, called Global Alliance for Women's Health. It was launched together with Gates Foundation, but we also have the G20 with the health minister from Brazil participating in this, and a few other health ministers from across the world. We had our Honorable Minister of Women and Child Development from India, Honorable Smriti Irani ji, participating in that as well. So it's been a great effort from various stakeholders to come together and launch this initiative. There are three areas that we are focused on through this alliance. One is to make sure that we bring visibility to this issue. We bring advocacy to this. Women's health has not been prioritized throughout the world. We are trying to see how we can again bring higher focus to this. We see that right now about 2 to 3% of R&D goes into women's health.
Yes.
The 80% of the drugs are tested on men, especially pain medication. Women are just treated as small men. Women are not a small man. It's a different biology. There's more research, more basic research that needs to be done. And we want to make sure that women are included in clinical trials. At least 40 to 50% of the clinical trial subjects have to come from the other gender, from the female gender. So we are working on that. The second part is getting more investment in this area.
Yes.
How do we get more investment to look at not just R&D, but also making sure that women have access to products and services? We're looking at some specific disease areas like endometriosis, menopausal diseases, osteoporosis, and others. So how do we bring investment in those areas? We have started to work with many companies here. About 40-45 companies have already signed the pledge. We have close to $50 million committed already for that. We have also started to work with big governments such as United States.
Oh, nice.
So in November last year, US government launched a White House Women's Health Initiative headed by First Lady Jill Biden. Now they are committing billions of dollars to this work for R&D for women's health. I was just there in White House about 3 weeks ago meeting with the chair of that Women's Health Initiative, looking at how we can bring further investment, but more importantly, how can we work together with public and private sector to initiate more innovation, to initiate more R&D in this area. So the innovation R&D is the third area for us. So starting from bringing higher visibility, doing advocacy, to bringing investments, and then finally making sure that R&D innovation is happening, not just in terms of products and product development, but also making sure that the delivery, the access part is taken care of.
Absolutely, and that is very important. And lastly, before we let you go, so COVID-19 happened. There were initial hiccups, but the rollout of vaccine, I think that was smooth. But God forbid if another pandemic happens. How prepared are we, according to you, for that?
I don't think that we are any better prepared, unfortunately. Unfortunately, we are now getting into pandemic fatigue, where we're thinking that it's over and it's now out of sight, out of mind. We need to work together to make sure that we are better prepared. Last time around, some countries did very well in terms of handling vaccine distribution, whereas other countries, other parts of the world suffered. You know, for example, Africa, there people were not getting any access to vaccine, whereas people in US and Europe were getting their third or fourth doses. India did a fantastic job. You know, India did a great job in manufacturing vaccines and then getting to its people. So kudos to India for doing a fantastic job there. But many parts of the world suffered.
Yes.
They didn't have access to vaccines. So we are working on some projects which are looking at that particular issue. How do we make sure that there is a regional production of vaccines, and not only that the vaccines are produced on a regular basis, but the manufacturing facilities can scale and they can surge during pandemic and produce new vaccine or pandemic vaccines. So that's one area. The second area is making sure that we are doing a good job of surveillance. So disease intelligence has to be there, and again AI can help there in a big way, whereby it could be looking at Internet of Things, could be looking at social media, it could be looking at other areas, looking for disease intelligence. As soon as a new disease or pathogen is surfacing somewhere, we want to make sure that we capture that as quickly as possible. We generate data on that, and not only we generate data, but we make it available at a global stage so that private sector can do its job. They can come up with medical countermeasures, they can come up with diagnostics, vaccines and treatments. So pathogen genomic surveillance, that's what we call it, or disease intelligence, that is really important for the world to do, making sure that we are united in that. Countries don't get penalized. This happened during COVID-19. South Africa reported a variant of COVID-19, and then everything was stopped for South Africa. All the travel, there were travel bans to South Africa, there were all kinds of pressures on the country. We don't want that. We want to encourage countries, we want to encourage people to share data, so that again we can come up with response, medical countermeasures against that pathogen. So there will be new outbreaks, that is for sure. The way we are living with climate change, there will be new pathogens, new outbreaks. The question is that how do we stop those outbreaks from becoming full-blown pandemics? How do we stop that pandemic harming a lot of people? That's the main challenge. So I don't think that we are any better, to your question, but I think there are efforts being made. There's funding that's now surfacing. We need to create more funding for this. We need to create more R&D and more global collaboration. One big thing that came out of COVID was that international collaboration can work. The example was development of vaccines within 10 months' time. We have never seen this in the history of mankind, where you can develop a vaccine in 10 months. But that was because of the global collaboration. Because the scientists from around the world worked together, regulatory authorities, countries, they funded, they worked together to come up with this vaccine in that short period of time. We want to learn from that and then increase the overall global collaboration to respond to something like this in future.
Absolutely, and I'm also looking for many more collaborations. And on that wonderful note, thank you so much, Mr. Bishen, once again, for sharing these valuable insights with us and taking the time out and being with us here on BT TV. Thank you so much.
Thank you so much. Thanks for having me again.
Thank you, sir.
Thank you.